So the appendicular skeleton, the arms and the legs, and the girdles that they attach to. Okay? So what we're looking at is the gray areas here attached to the yellow. God bless you. All right? So appendicular is 126 bones, and they're pretty easy to manage. There's some organization there. We have one bone, two bones, many bones. One bone, two bones, many bones. Our leg does the same thing too. One bone, two bones, many bones. Okay? And the many bones is actually the easiest part to believe it or not when we get there. Trust me, okay? So let's do the upper limb first. Okay? We'll start with the scapula. The scapula, there's two of them. And they sit like this. Right? So what you're looking at is the posterior view of the scapulas. Okay? The curved ends face each other. They don't go this way. They do this way. Almost looks like a heart. Okay? Also, when you look at one, so this is going to be our left one, posterior view. When you look at it, the posterior view has bumps all coming out of it. This big, what we call spine coming out of it. When you look at the anterior view, it's smooth. You would expect the smooth part being against the ribs. You wouldn't have this big bulging thing going against the ribs. Okay? So to help you along with, is it the right or left, you got to pick something that's going to be anterior or pick something that's going to be posterior. Pick something also that's going to be medial and pick something that's going to be lateral. Once you know what that is, like you're going to say to yourself, oh, this bony thing coming out, that's going to be posterior. Good. Well, then try and look for, well, the round part over here is always medial. So now you could say, if this is posterior, this is medial, then this has to be the left one. So you got to pick two things. And that's what you have to, and that's good because that's making you be more conscious and paying attention to detail about each bone. Okay? So that's the scapula. So let's look at it closer. Okay? So now I'm going to get the right one, because that's what this is. So we're going to get the right one over here, which matches this one. Okay? This is the posterior view. There's the spine. Okay? We're going to look at the upper section and lower section of the spine. There's a little depression that goes in there. And there's a depression that goes down here. Okay? Depression, depression. This is called the supraspinous fossa. And it makes sense. Don't fight the words. It's a fossa because it's a depression. Supraspinous. It's above the spine. So then this bigger one is going to be the infraspinous fossa. It makes sense. And underneath the whole thing, this big curvature thing that's under the whole scapula is the subscapular fossa. Sub meaning under. Don't fight it. It makes sense. Okay? Now you also have these bumps that come out of here. Now this is what I mean. It's easier for you to get it in your hand and follow the pictures, because you can't really appreciate the lateral aspect. So we're going to take this and turn it towards you so it looks like that. So we're looking at the lateral aspect of the scapula. We have a curved area, depression right here. It's called the glenoid fossa. When we get to the humerus, which is your upper arm, the head of the humerus goes into the glenoid fossa. Creates that ball and socket kind of joint. Some people, it's a little bit deeper, so it's not a fossa, they call it a cavity. So I'll accept glenoid cavity or glenoid fossa. Same thing. Then you're going to have these two bumps up there. There's one, the upper one is called the acromion. And then we have another one that kind of bends on itself. It's called the coracoid process. They call it the coracoid because in Latin it means crow. And I don't know, I guess it kind of looks like a beak of a crow. I don't know, but that's what that is. Now, what's going to attach to the acromion process, so it could be the acromion or acromion process, same thing, is going to be our clavicle. The clavicle is going to attach to the acromion. And this articulation, listen to the words, is called the acromioclavicular joint. It makes sense. It's not called the coracoclavicular joint because the clavicle doesn't go to the coracoid process. It goes to the acromion. So if you had a subluxation or which is a fancy word for dislocation of your acromioclavicular joint, you know where that is. Clavicle. The medial end of the clavicle attaches to the manubrium of the sternum. The lateral end attaches to the, articulates with the acromion. There's a few other things you should know about the clavicle that might appear on like a bonus question. So you might want to jot them down. The clavicle is known as the collarbone to laymen. The clavicle is the most commonly fractured bone overall. The clavicle is the first bone to ossify. The clavicle is the only long bone that ossifies via intramembranous ossification. All the other long bones ossify by endochondral ossification. And the clavicle is the only long bone that's situated parallel to the floor, with the exception of the phalanges of the feet. The clavicle is the only long bone that's situated parallel to the floor, with the exception of the phalanges of the feet. Okay? So that's the scapula and the clavicle. Now let's look at the arm itself. Remember, one bone, two bones, many bones. Okay? One bone, two bones, many bones. The humerus is the upper arm. The forearm is made up of the radius on the lateral side and the ulna that's on the medial side. The wrist bones, there's 8 of them. They're called carpals. And then you're going to have a set of long bones coming off the carpals distally. They're called the metacarpals. And then you've got a slew of phalanges. We'll get into the hand in a moment. But let's look at the humerus. And humerus, be careful of the spelling. It's not ha humerus. Okay? The humerus. There's 2 necks of the humerus. Let me point them out first and I'll explain what they are. You have the surgical neck of the humerus there. The anatomical neck is there. The anatomical neck is where the epiphyseal plate is, where growth occurs lengthwise at the anatomical neck. The surgical neck is the most commonly fractured area of the humerus, if we're dealing with the head of the humerus. Anatomical neck is where the epiphyseal plate is. The surgical neck is where it's most commonly fractured when we're dealing with the head of the humerus. Okay? Now, this is the right humerus. And we have a couple things over here, down at the distal end. Of course, I took the left humerus. Okay. So this is the right humerus on the picture here. We have two areas that are on the outer aspects of the humerus. These are epicondyles. Epi meaning outer. We have a medial epicondyle and a lateral epicondyle. More medially, we have two things. This is called the medial condyle and the lateral condyle. But they have other names too. The lateral condyle is also known as the capitulum. The medial condyle is also known as the trochlea. Okay? You could use either or. But it's sometimes helpful to know the trochlea because we're going to talk about something on the ulna that the trochlea attaches to, and that helps. We also have a little fossa on the anterior aspect in the middle or in between the condyles. It's called the coronoid fossa. This is all anterior. When you turn it around and look at the posterior aspect, you have something that's another fossa on the posterior aspect, and this is called the olecranon fossa. You would appreciate that when you get in your hands. Okay? Questions on that? All right. We have something similar going on with this when we deal with the femur. We'll get there too. Okay, the radius and ulna. The radius is on the lateral aspect of your forearm. That's where your radial pulse would be by your thumb. If you see a nurse or any medical professional that's trying to take a pulse on the pinky side of your wrist, that person's a quack. All right? The person's not doing his or her job efficiently. The medial side has the ulna, and the ulna is pretty easy to recognize because to me it looks like a wrench. It has that little U there for ulna. So I guess God created it for that reason. No. All right, it has that little notch there, and it looks like a wrench to me. The only bone, long bone that has a wrench-like thing. Okay? That notch over there has a name, like everything else. It looks like half of a moon, so we call it a semilunar notch. Or we could call it the trochlear notch. That's helpful because that articulates with the trochlea. And when it does, you've got yourself the elbow joint. Okay? That's why it might be helpful to know the medial condyle as the trochlea also, to help you with what articulates with that. Okay? The equilibrium process is the end of the ulna. What you're feeling down here on your elbow is the equilibrium process. That area, as you've learned from before, is the equilibrium area. Okay, so this is just a close-up of the elbow. So you can see how it all articulates there. You can also see the end. This is the proximal end of the ulna, and you can see the parts over there. Okay? All right, let's talk about the hand. We'll do this in a minute. Here's the radius. Here's the ulna. Here's the carpals. There's 8 of them. Call it the carpals and call it a day. I think you're in a grandfather clause. I think starting my next semester, a lot of teachers want them to know those carpals. So this is maybe the last class I might be doing that. Okay? So right now, just call these 8 bones the carpals. Then you have the metacarpals coming up here. In the palm of your hand are your metacarpals. And there's 5 of them. Now how we label this is your first digit is your thumb. That's digit 1. Your pinky is digit 5. Okay? And you have a slew of phalanges that are up here. They're easy to manage. There's 3 phalanges in each finger. This is the proximal phalange, or phalanx. It's really called a phalanx. Phalange, more than one phalanx is called phalanges. But, so this is the proximal phalanx, middle phalanx, distal phalanx. That makes sense if you know proximal and distal. Again, the reason why I want you to do that quest pretty well, okay? So you have proximal, middle, and distal on all the digits except for the thumb. These are a little exception. There's only 2 phalanges there. There's no middle, so there's just a distal and a proximal phalanx. So let me ask you this. In one hand, how many phalanges do we have? Count them. Count them. How many do we have in the thumb? Right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Oh, is that not an extra?
No, just the end of it.
Oh.
Yeah, like I said, the thumb only, there's no middle phalanx. Okay? Does that make sense? Okay? Now, that's it. You know the fingers, or the whole hand, even with that many bones. Let me show you this. I broke my proximal phalange of my 4th digit. Give it a moment. I broke my proximal phalanx of my 4th digit. Everybody here should know where to put the X. Proximal phalange of the 4th digit is this one right here. See it? Right here. I broke my distal phalanx of my 1st digit. Yes, boo-boo on your thumb. Right there. I broke my middle phalanx of my 1st digit. That's a trick question. I don't do trick questions. Do you see why it's a trick question? There's no such thing as that. There is no middle phalanx of the 1st digit. The thumb only has 2. Okay? Any questions about the hand? If we were going to put a wedding ring, it would go on what phalanx? Proximal phalanx of which digit? 4th digit. You see what I'm saying? Okay? It doesn't go on your metacarpals, which a lot of people would say. I don't know how. Okay? Yeah, you're all laughing now. You wouldn't be laughing 2 hours ago. See? That's what I'm saying. You guys are in this, you're getting the mode now. Okay? And we talked about arthritis. Now look at this. Now you can appreciate some of this stuff. There's only 2 joints in the fingers, not the thumb, in the fingers of everyone's hands. Okay, at least in the fingers. You could also say that there's one where your palm meets your fingers. Sure, then that's a third. But look at this. This here, where your palm meets your fingers, these are called the metacarpal phalangeal joint. Listen to the words. Metacarpal phalangeal joint. It's where your metacarpals meet your phalanges. It can only be one place. You can't say which phalanges. No, that wouldn't make any sense. There's only one that attaches to it, and it's the proximal phalanges. These are called interphalangeal joints. We could have proximal interphalangeal joints or distal interphalangeal joints. That's all you would have. Okay? So now you can talk about people with arthritis and which joints. This is speaking a new language, which you're all going to get into in your medical fields. Okay? And we talked about rheumatoid arthritis or osteoarthritis, right? Okay?